adopted by the Congress, signed into law by the President, that would help to control the rapidly rising cost of health care and make it available to considerably more people. However, I cannot support the legislation that is working its way through the Congress right now. It's now been passed by 3 different House committees, and they're all somewhat different from each other. They have the same general thrust. They have to be merged into one bill before they can be voted on by the House of Representatives. And then in the Senate, there's one bill that's been passed out of one Senate committee, and then there's another Senate committee that I think is doing something that's important but has not achieved any success yet. And that's the Senate Finance Committee. It's chaired by the Democratic Senator Max Baucus from Montana, and he's pulled together 3 Republican senators and 3 Democratic senators and is trying to work on a bipartisan health care reform bill that does not include a government insurance option, which I think is one of the serious problems with the legislation that is working its way through the House and passed out of the other Senate committee. And here's the reason why. This government insurance option will be subsidized very heavily. The overall cost of this legislation is estimated by varying budget offices and other groups and so on between $1 trillion and $2 trillion over 10 years. This is an enormous amount of money, and when you consider how enormous our deficit already is and our national debt is piling up year after year after year, that we are leaving to our children and grandchildren and people who are not yet even born, we have to, I think, first address the fact that health care is too expensive already, and not layer on top of that a new government program. In fact, that government program is only the centerpiece of 53 government agencies and programs that are included in H.R. 3200, the legislation that has reached the possibility of coming to the floor of the House. That concerns me greatly, because not only will we be imposing taxes on employers, except for the very smallest employers, taxes will be imposed, an 8% payroll tax to pay for this, which will be a problem for some employers who may go out of business or see jobs go out of this country. But in addition, we will also see other employers who do provide health insurance see new mandates, many new mandates. The bill includes a health insurance commissioner who will dictate what private health insurance companies can offer. Because if they're going to make this requirement that you either pay the 8% tax or provide health insurance, you can't just say, well, I'm providing health insurance, it's one annual checkup for the year, that's our health insurance. Obviously, that would be an easy way around paying an 8% tax. So they're going to dictate what health insurance companies have to offer in their plans. This is going to make health insurance plans more expensive, and it is going to mean that they have to compete, adding costs on that side against a plan that is going to be heavily subsidized by the federal government, which, as you have seen, is more than willing to spend an awful lot of money on almost anything that you can think of. So when you put those 2 things together, many employers may find that it is less expensive for them to drop their health insurance and pay the 8% tax and have their employees go onto the government plan. In fact, there are 2 studies out. One says that more than 100 million Americans will lose their private health insurance and be forced onto that government plan. The other says 120 million Americans will. Now, 120 million Americans is about 2/3 of all the people in this country who have private health insurance today. And I think that is what has concerned so many people who have contacted my office, who have come to my town meetings, who have participated in my telephone town meetings that we've conducted around the district as well. And it also greatly concerns me. I do not think that is the best way to go to achieve the kind of reforms that we need. And it would be better, in my opinion, to scrap that bill, to start over again in a bipartisan way, and either with one bill or targeted pieces of legislation, adopt things like association health plans that would allow people who are small employers or people who may work for a business that don't have health insurance, or people who are self-employed, to get into large pools perhaps even spread across state lines. It might be 50,000 or 100,000 people. Now, instead of a small employer having a situation where they have one employee who has some serious health care issues and therefore their rate is very high, they can spread that risk amongst a very large pool, just like a large corporation does, just like other large group insurers do. That, I think, would be one of the key reforms to help us keep private health insurance and yet make it more affordable and more available to more people. We should also be encouraging health savings accounts, which allow individuals to put money tax-free into an account. The build-up, as you save that money, is tax-free. When you use the money, it's tax-free again. That's the only program like this that exists in the federal government. You know, retirement programs like 401ks or IRAs, you have to pay either the tax before you put it in, and then you get it tax-free when you take it out, or you put it in tax-free, and when you take it out, you pay a tax on the original principal you put in, but not on the build-up. This is totally tax-free, and you can use it for any kind of health care that you want to use it for. It's available right now. More and more people are turning to it. Several million people use it, and this legislation would eliminate it. So that concerns me. I had a gentleman at my last town meeting in Roanoke who participates in what's called the Medicare Advantage program. It is an effort to try to reform the Medicare program and give more competitive opportunities for people. Right now, if you're on Medicare, you know that it doesn't cover a lot of things, and you have to buy a supplemental insurance policy in order to do that. Well, this replaces that supplemental insurance policy, and the government pays the insurance company to cover a group of enrollees. They have to manage that group within that range, but at the same time, they offer things that are not offered by Medicare. And this gentleman likes very much his Medicare Advantage plan and doesn't want to give it up. That also is going to be eliminated by this legislation. So it seems to me that it is a grave concern that we're going to be taking choices away from the American people, not giving them more.